For me, the great questions of our life come and lie with the governments, and that is why ADI at heart is a organization that advocates both with international bodies, international government bodies, so with the WHO, with the UN, with OECD, with the G7, and so on and so forth, but also national governments. I mean, ultimately, it's important that a government understands even the scale of the problem. In my career, and I haven't been with ADI for that long, only about 7 years, I've spoken to several ministers of health in nations, even big nations, where the actual minister didn't know that dementia was a disease, didn't recognize the name, didn't know what I was talking about. Some ministers more overtly told me, I don't have dementia in my country, which, considering that we publish all the data, facts and figures on incidence and prevalence, it's not possible. So, but this is what I am up against. So the role of governments is critical, because if you think about it, I represent a civil society organization, and a lot of my members are the largest civil society organizations on dementia and Alzheimer in their country. But we can only do that much, because obviously we rely on the generosity of our donors or the people that have experienced this and give something, but it's never going to be enough in order to be able to train the primary healthcare doctors and the more specialized doctors who provide the diagnostic systems and to do public health campaign on risk reductions, to ensure ultimately the most important thing is that people living with dementia and their family receive the care that they need and they deserve, and they are not subject to mental health breakdown, which is unfortunately too often the case in people even living in high income countries.